Hi everyone and welcome to Daytime. It is Thursday, January 28th. I'm Deja Gordon. Welcome to today's show. Now before we get going, I want to remind everybody we have a very important deadline that's coming up. That's on February 1st. We are writing to the CRTC and telling them why we think television is so important to you and of course to us here at Rogers TV. So if you feel like you have something to say to the CRTC and express why you think Rogers TV is so important to you, please do that. You can reach them via our website. That's at rogerstv.com. There'll be a link on the page that'll take you right to the CRTC website. Just a few words about why you enjoy the programming here. Maybe you've had a community group that's come on our show and it's helped promote an event. Whatever it may be, you just let them know and we'll be glad to take your support. Now we're going to go right to today's show. With us we have one of our most favorite guests. You'll see him quite often in our show, Dr. Arun Narang. He's with me now. Welcome to the show today. Thanks for being here.
Thank you.
Well, before we get into our show with you, and I want to ask you some great questions, of course, and give us some dental advice.
Sure.
Why is community television so important to you?
Well, you know what? I really think the local angle is excellent. You know, we're getting less and less of local news, budget cuts. I've been seeing, local TV programming getting axed, etc. I think there's a real value in having local programming, and Rogers is providing that, to special interest groups, to the public at large. So I think there's a real value in that.
Have you written your letter to the CRTC
Yes,
yet?
I have. Yes, I have.
I know you've been asking all of our favorite
I
guests.
got an email from Patrick, and I said, okay, Patrick, I will do so. Because not so much because he's asking me, but I believe in it.
Yeah. Well, we thank you. On behalf of everyone here, really thank you. And I encourage, again, all of our viewers as well.
Yeah, I would too.
Now, of course, you're here to give us some great dental advice. You always do. You always have great things to tell us. Today, you're telling us about a brand new product and something that you're using in your office. Tell us a little bit about it.
Well, it's called CEREC, and CEREC's been around for a while now. I mean, it keeps getting better. CEREC is an acronym for Chairside Economical Restoration of Aesthetic Ceramics.
Ceramics.
And it's a revolutionary way of being able to provide our patients with a strong, biocompatible, anti-abrasive, plaque-resistant, restoration in one visit that also preserves enamel and helps us to keep more of our enamel.
Well, you said one visit, so really you get this done. There's no maintenance that required. It's aesthetically pleasing, of course. That's why people are doing this, to make their mouths as beautiful as they can.
The maintenance is just coming in for your regular checkups and cleanings, and the nice thing with it is, no temporaries, no second visit or a second freezing, no impressions going into your mouth, and we're able to provide an inlay, onlay, or a crown, and also veneers, like for the dentists that are more lab oriented or doing some of their own ceramic or lab finishing in the office. They can even do aesthetic work at the front of the mouth in one visit with veneers, etc.
So what type of client would this appeal to? What's happening in their mouth that they think, this works for me?
Well, I think it would appeal to the type of client who's looking for dentistry that is going to mimic nature more. We're trying to get into biomimetic dentistry where we're conserving enamel, people who want to conserve their teeth, have less of the tooth removed, have something which is biocompatible, strong, there's no metal in it, so it's going to appeal to those kind of people who want something that's going to be strong and biocompatible. I think it's also going to appeal to those people who hate impressions or second visits or are time starved and want to complete their work quickly.
I think that's me. I think that's me. I actually went to the dentist yesterday. I was just telling this to you in our break. No cavities.
Good.
No cavities, Mom. I'm doing good. But I was really surprised by my cleaning how white my teeth got. I was very surprised. Now, will this impression or this aesthetic I guess an initiative, what is it, really a product, really? Will it keep white? Will it stays white with your teeth?
So ceramic, basically, because it's been machine milled, it's a pre-made product, and we're milling it. So we're selecting the color to match the color of your teeth.
Okay.
So if it is going to, be on a tooth in the aesthetic zone in your smile, we'd always recommend, if you're going to want to whiten your teeth, that you do it ahead of time, so that then we can match or custom match the material to your teeth.
Oh, great. And so how long would this visit take to get this procedure
Usually
done?
60 to 90 minutes for one restoration.
For each tooth?
Yeah, for each
that's
tooth.
not that bad.
And again, if you're doing multiple teeth, then if you're doing 2 or 3 teeth, then, again, less time, because we already have you there anesthetized, and, we're already working in that area, so then we can do it, more quickly.
Well, you mentioned you use this procedure more for the back of the mouth. Can you use it in the front as well?
Yeah, you can. Like I said, again, the thing is at the front, there's more demand for aesthetics. So it really then requires some finishing or glazing, which you can do in office for those that are inclined to do that. Or then, you know, it's something that, you know, you just want to make sure that you're spending enough time to make it look attractive.
Make it look great.
Yeah.
And you're also using what you got, which is so great about this as well, right? You're not having to
That's
replace
right.
the whole tooth.
That's right.
That's so wonderful.
And you know, unfortunately right now there's only about 5 or 10% of dentists that have this technology because it's newer, it's more expensive, there's a learning curve for the machine, but more and more people are, you know, using it and trying it, and it's becoming more popular. And there's a lot of new emerging things too, new technologies with the machine that you can do. So we're excited about that as well.
Well, let's talk about that a little bit more, because I know you've been a dentist for quite some time. Of course, you've been even an expert on our show for quite some time. It's so wonderful. What type of changes have you seen in the industry?
Oh, enormous. I mean, you know, now we're getting, you know, like with CAD/CAM, these are digital impressions. So we're able to take a digital impression, create a really quality restoration in one visit. We're going to be able to create temporaries for teeth that are getting implants with CEREC, you know, the same day. So instead of walking out with no tooth or a little flipper denture, you'd be able to walk out with a restoration on the implant made with the CEREC. It also will help to create temporaries templates to tell us where we could place an implant, you know, in the mouth. And there's lots of really cool things that are happening in dentistry. Not only with CEREC, but just materials, techniques, technology.
One of my least favorite parts was always getting the impressions done. Even the fluoride cases, I don't remember if you remember those, it was like an impression. It was my least favorite moment at the dentist. I still have a good relationship with them though. Actually, you know what? When I went there yesterday, I went to tell viewers at home, they still had my picture on the wall from when I was a kid of no cavities, and because I have no cavities, it's still there.
That's great.
So wonderful. So every 6 months, it's always really important to go to the dentist. Would you encourage people to come more often than that?
You know, it's all basically, everyone has a different need. So there are patients that need to come in every 3 months. Certain patients we recommend every 4 months. Certain patients every 6 or 9 months. So we tailor make it to your needs.
Okay.
No, there's no cookie cutter approach.
All right, because I've always heard 6 months, 6 months, 6 months, and apparently that's not right. So.
Well, again, you know, just as I said, it's great if you're seeing your dentist regularly. So we would encourage you to see your dentist regularly, and then again, your hygienist and or your dentist can then, you know, tailor make it to your needs and explain to you why you need to come in more often if needed.
Okay, great. Well, any new products? I know sometimes you bring in some great toothbrushes and things like that. Anything you can encourage our viewers to go and pick up at the maybe the pharmacy this weekend to try for their teeth?
Well, you know what? I mean, again, if you're using a manual toothbrush, you might want to look into some electric toothbrushes. There are so many different models out there now, and we talked about it before. There's some really economical ones, like the Vitality brush, which is only about $20, $25. But there are so many different brushes. Try out an electric toothbrush if you haven't.
And as you mentioned, try and find what's best for you. It's different for everybody. Well, thanks for being with us today. Of course, we have one of your smile files on right now, giving you some more helpful tips to keep your teeth white and clean. We'll be right back on Daytime right after this.